Thank you for taking the time to join us for this video with Dr. Milton Raff, entitled Enhanced Recovery After Surgery, ERAS Guidelines, Protocol Implementation. More than 200 million surgeries are performed worldwide each year. Enhanced Recovery After Surgery programs, or ERAS programs, are a shift in traditional perioperative care to a multimodal, multidisciplinary approach that aims to improve clinical outcomes by decreasing patient recovery time, reducing hospital stay, and shortening procedural time. The key to implementation of ERAS is a multidisciplinary team effort toward mutual goals and enhancing patient outcomes postoperatively. Dr. Raff now highlights the key principles of ERAS and its importance for hospital and patient outcomes. Dr. Raff also provides guidance on how to implement ERAS effectively.
What does ERAS mean? Enhanced Recovery After Surgery, the so-called ERAS guidelines. The goals of ERAS are very simple. The goals are that we need to take the stress response and decrease it so that we can have a shorter stay, we can have a shorter ICU stay, and we can have less complications, better and earlier functional recovery, and ultimately lower healthcare costs, but a better patient experience. The happy patient is our best advocate. The current ERAS protocols has the commonality of a combined pre, intra, and post-op modality to decrease the surgical stress response. In the ERAS guidelines, you will see we need to counsel and optimize the patient preoperatively. Intraoperatively, again, you are hearing stress reduction, the regional anesthesia, you'll see minimal invasive surgery, effective pain relief and nausea and vomiting prophylaxis, prevent the surgical site infections. This continues now into the post-operative phase in fluid restriction, removal early of catheters, early ambulation, and early feeding. And notice the very last point, continued multimodal pain management. How do we implement this? Successful implementation depends on collaborative inter- and multidisciplinary teams. We need to educate patients and staff. Who are the champions that will lead this? That is the guiding coalition. And the answer to that is you need multidisciplinary. You need a surgeon, an anesthesiologist, and nursing champions at your site. These three champions, they have to assist in organizing multidisciplinary rounds within the hospital and to make sure that people attend these multidisciplinary multi-site meetings and liaise. All the professionals need to speak to each other in order to make this happen. Which ERAS pathway to choose? Choose the appropriate one for your department, for your hospital, so that it's one at a time, not all. Choose the pathway you want, keeping it very simple, and define exactly what you want to fix. Introduce it, plan it, get the interdisciplinary approach, keep assessing what you are doing through education and training, and recognize the challenges early on so that you can address them and make changes. Be careful not to do this fast. The idea is to do it slowly. Get the core team, incorporate other professionals, discuss the data and the protocols one at a time, adapt it for your own institution, empower the people that are actually doing it to do it. Again, look at the data, and finally, update the ERAS all the time. Share your data with all of those who are involved in your initiative. If the data is good, the initiative carries on. The short term won't is to consolidate this, and you can prove the success. Monitor your results.
Research has consistently shown that adoption of ERAS programs may lead to significant improvements in patient satisfaction, outcomes, and reduction in cost of care. ERAS is a relatively simple, pragmatic concept, and implementation requires a strategic, interdisciplinary approach and ongoing evaluation. The ERAS Society website provides ERAS guidelines, which are based on current evidence and are available for common surgical procedures, alongside information and training for ERAS implementation.